So this is really an unprecedented time for science. We've been in conversations that were more like fireside chats than scientific conversations because everybody on the call is so interested in what's going on and we're working together. I have never been in a situation where I could talk to the CDC, the WHO, the NIH, and the Gates Foundation like they were in my living room. And that's what this exceptional time is actually affording us. It's really a silver lining for science and how we move things forward. So the research question that needs to be answered in a nutshell is whether or not a mother can pass COVID-19 to her baby via breastfeeding.
We also were working closely through our professional organization, the International Society for Research in Human Milk and Lactation. And that's where many of our friends and collaborators that we're connecting with are also in professional society. And so that larger group has really provided the momentum for us to reach out and find not only researchers, but potentially places to find the human subjects that we need to do to answer the question. So this is the basic capacity funding that allows institutions to be responsive to what the problems are today. And this occurs across all of our ag research settings. And it also allows for that basic funding so that the extension service can mobilize and also support making sure that the communities are healthy, making sure that the rural population is getting the best healthcare, broadband, etc. So we are responding as the Hatch Act and the Smith-Lever Act really was established to do, is to give basic infrastructure in research and outreach for every state.
But this is not a normal situation where we can put together a grant that's due in June and maybe we get back feedback next August and then we resubmit it again. We don't have time to wait for money like that. So we are trying to find emergency sources of money immediately for the boots on the ground for the work that needs to be done.
Every support group that is on campus is helping us move it forward. So it really is a full institutional effort. Over a period of 10 days, we were lucky enough to get funding from the Bill and Melinda Gates Foundation. It was been a whirlwind of activity.
Yeah, what we're hoping to find out within the next 2 months is whether or not we can detect the virus in milk. And we really actually think we can get that answer, at least a preliminary answer, in 2 months that then can be shared with the CDC and the WHO. Now that we have funding, that in a way that was the easy part. So now we actually need to recruit women who have been diagnosed with COVID-19 within the last day or two. And they can be anywhere in the country, and we will consent them and send them the collection materials, and they can collect milk and send it back to us and be part of team science here at the University of Idaho.